is March the 6th, 2025, and I hope everybody's been having a wonderful day so far today. I just want to start off today's video and say welcome to anybody that's new here to this channel. I would imagine that the subject matter for today's video might attract some new viewers to the channel. And like I said, I just want to say hello, welcome, thank you for being here. I really appreciate you watching today's video. Just a really quick synopsis on who I am. People call me LD. My channel's name is liver disease, which I do have. I have cirrhosis. I have been diagnosed with chronic pancreatitis and a whole host of other things. I have had multiple surgeries at this point due to my consumption. I've had, 13, 14 ERCPs done on my pancreas. I've had 2 TIPS procedures on my liver. I don't know how many stents in my liver now. I think like 7 or 8 stents in my liver. I've got stents in my pancreas. I've had a splenic embolism done twice. I've just had a lot of health problems because of my consumption, and I decided over a year ago, actually about 2 years ago at this point now. I made my first video in March of 2023, and I just decided that I wanted to come on and try to help people who are suffering with addiction, AUD, alcoholism, or anybody that might be suffering with health-related problems due to their consumption of whatever type. There was a time when I felt so alone. When I was laying in my bed, I was bedridden for about 3 months after I got out of the hospital for the second time. That was the time that I found out that I had cirrhosis, and they gave me a year left to live and just basically told me to go home and spend time with my family. And during that period of time, I always enjoyed watching YouTube. I decided to get on YouTube and try to find other people like me, try to find videos that might be able to help me. And there just wasn't a lot of information on YouTube at that point. So I made the decision to come on here and start making videos and try to help people. I really wanted to try to help people not feel so alone in their illness, and try to share things that I've experienced, maybe make things a little bit easier for other people, try to share tips and tricks that I've gone through, things that have helped me. I've made so many different videos. At this point, there are over like 400 and something videos at this point. I've discussed so many different topics about addiction, alcoholism, AUD. I've even made videos on how to lay in the bed when you have ascites. Please feel free to scroll through all the videos that I have. At some point, I need to categorize them and put them in an organized spot so that it'd be a lot easier for people to find what they're looking for. But like I said, there are so many different subjects that I've touched on addiction and AUD and all that stuff, and the illnesses, things that I've experienced, procedures that I've gone through. Things like ERCPs, I've made videos about, what to do, what to expect, even how, what you should pack in your bag when you're going to the hospital. There's all kinds of things I've discussed on here. So anyway, thank you so much for being here. I really do appreciate it, and I hope you enjoy today's video. What we're going to be discussing today is the MELD score. And before I get into today's video, I just want to preface this with a quick disclaimer. I am not a doctor. I am not affiliated with any healthcare professionals, not with any hospitals, doctor's offices, anything like that. I'm just a normal guy who has been through a lot of different things due to my consumption and the health problems that I've had because of it. If you feel like something that I might have said is incorrect, it probably is. I'm not a doctor. I've learned things from my experiences, from all the times that I've had to go to the hospital or speak with doctors, or thousands of people that I've spoken with at this point, and just research that I've done on my own. But once again, like I said, I'm not a doctor or anything like that. So if you feel like something I might have said is incorrect, please go and do your own research and check it out, because I mean, I possibly could be. I just want to make sure that people understand that and, take what I say with a grain of salt. But with that said, let's go ahead and hop into today's video. All right, guys, well, let's go ahead and get into MELD and what it is. So what does MELD stand for? And MELD is an acronym. MELD stands for a model for end-stage liver disease. It's a number that estimates how urgently a patient with liver disease needs a transplant within 3 months. The score is calculated using a formula that considers the patient's blood test results. The purpose is the MELD score is used to prioritize patients on the liver transplant wait list. It is also used to predict a patient's 3-month mortality risk. How is it calculated? The MELD score is based on 3 lab test results. Bilirubin measures how the liver removes bile. The INR, or International Normalized Ratio, it measures the liver's ability to create blood clotting factors. And creatinine, it measures kidney function. What it means. So this is going to break down exactly how the MELD thing works. And MELD goes from 6 to 40. So the higher the MELD score, the more urgently the patient needs a transplant, and the higher the risk of death within 3 months. So the closer to 40 is means that your liver is worse off. The lower your number is, so if your number is like a 6, 7, 8, something like that, that means that your liver is in relatively good health. A 6 is like a normal person walking around that never drank, doesn't have any health problems, anything like that. That would be a 6. You could think of like, a 15-year-old kid that's never drank alcohol and is completely healthy would have a MELD of a 6. Probably a majority of the population that's walking around on a day-to-day basis, they probably have a MELD of a 7 or 8, 6, 7, 8, somewhere around there. So other considerations. A doctor should consider a patient's medical history and experience when using the MELD score to make treatment recommendations. In other related models, the pediatric end-stage liver disease, or PELD model, is used for patients under 12. So like I was saying, the MELD score stands for model for end-stage liver disease. And it's a way for them to calculate the health of your liver and decide where you need to be placed at on the liver transplant list. So the higher your number is, the higher on the list that you're going to be. You're going to be bumped up closer to the top. The lower your number is, the least likely that you're going to be having a liver transplant done any time in the near future. So I pulled this from Duke Health right here, and I'm going to read this off. And this is basically talking about, waiting for a liver transplant and what they have to say about it. So waiting for a liver transplant. Step 2, the wait list process and preparing for a liver transplant. Liver transplantation can prolong and improve your quality of life, but waiting for an organ donor can be frustrating and stressful. The wait period for a liver transplant varies, but the median time to transplant for patients on the wait list is much shorter than the national average. As you wait for surgery, you will meet regularly with doctors and other members of your transplant team to assess any progression of your liver disease and provide you with resources you need to stay healthy. The liver transplant wait list process. If you are a candidate for a liver transplantation, you will be listed on the national database maintained by the United Network for Organ Sharing, or UNOS. UNOS wait times are based on many factors, including blood type, the size of the liver's donor, body size, geographical distance from the donor, and your MELD, model for end-stage liver disease score. So what does my MELD score mean? The score is based on blood tests that measure. And this one right here has another one added to it. It's not just 3 like the last one I read you. So kidney function or creatinine, liver function, bilirubin, blood clotting time, or the International Normalized Ratio, or INR, and sodium level. MELD scores range from 6 to 40, like I was talking about earlier. The higher the score, the greater your need for a liver, and the higher your place on the wait list. When a donor liver becomes available, it is offered to the sickest person on the list who matches the donor's characteristics like body size, blood type, and is geographically closest to the donor. If the liver is not a good match for that person, it is offered to the next person on the list until it is accepted. In July 2023, MELD 3.0 added current sex and albumin levels to the MELD score calculation. MELD 3.0 is shown to better predict who needs a liver transplant first and addresses disparities between men and women. Reducing your wait time for a liver transplant. The liver is a regenerative organ, meaning if it is healthy, it can regrow. And the thing, our liver is the only organ that regrows in our body. This capability creates alternatives to traditional liver transplantation, including split liver and living donor transplants. Your doctor or transplant coordinator can talk to you about these options after you are listed for a transplant. Split liver transplant. And this is talking about Duke Health or Duke University is saying that we're one of the only few liver transplant hospitals to divide a healthy liver from one donor between two patients, typically an adult and a child. These split liver transplants can shorten your wait for a donor liver and allow us to save 2 lives rather than 1. Living donor donation. In a living donation, part of the liver of a healthy adult donor is removed and transplanted into the person with liver disease. Donors must be in excellent health to donate. Staying healthy. As a candidate for a liver transplant, you have a responsibility to stay as healthy as possible before and after surgery. This means eating properly, exercising regularly, quitting smoking, abstaining from alcohol, taking your medications as prescribed, and keeping appointments with your transplant team. And I cannot stress how important that is. Making sure that you're getting to your doctor's appointments when you're supposed to be, because they're going to be looking at all that stuff, as well as abstaining from drugs and or alcohol. They're going to be testing you. If you're waiting on a liver transplant, they're going to test you, and they can see if you have drank or used. They can also see if you smoked. If you do those things, it's going to knock you back. You don't want to end up with that. So if you're waiting on a liver transplant, you really want to try to maintain as healthy of a lifestyle as you possibly can, and that includes trying to eat as healthy as possible and trying to exercise as well. It says right here, we have a zero tolerance policy for alcohol, nicotine, and drug use and may randomly screen you for these substances. Establishing healthy habits before surgery will also help you as you recover and in your life after transplantation. So I've got another article that I want to read for you guys here, and it's called Understanding the MELD Score. There is a significant gap between the organs available for transplant and the number of people on the liver transplant waiting list. A reliable method of determining the severity of illness is critical to make sure the patients with the greatest need to receive priority on the allocation process. The MELD scoring system. To address this issue, UNOS uses a formula called the MELD, Model for End-Stage Liver Disease score, that provides a numerical calculation based on the following information. How effectively liver excretes bile, or bilirubin. Patients with an elevated bilirubin may have jaundice or the yellowing of the skin and eyes due to the inability to effectively remove bile. And when I was in the hospital the second time in Columbia, South Carolina, I had jaundice really bad. My skin had turned orange, my eyes had turned yellow, my urine had become basically opaque. You couldn't even see through it. It was so brown. It looked like Coca-Cola, basically. It was that dark. I was dealing with basically, all of the symptoms of having liver disease at that point. I had ascites, jaundice. I was dealing with the confusion, basically everything under the sun. I was extremely ill, and that confusion is called encephalopathy. I really didn't know what was going on during that period of time. I was so confused. I was so ill. They were draining me off. They were placing a needle in my stomach and draining off the fluid. And they had done that as soon as I got to the hospital, because I was originally at a hospital here locally and then was moved up to Columbia. As soon as I got there, one of the first things that they did was a paracentesis, where they removed the ascites. They were really concerned about doing it, but they went ahead and did it. And one of the problems that can happen when you have a paracentesis done is that they can, accidentally introduce bacteria into that fluid in your stomach, which happened with me. I ended up going septic while I was in the hospital and became extremely ill. I came this close to not being here after that, but they were able to pull me through it, and I came out on the other side. But, like I said, I did have jaundice during that period of time. And one of the things, too, is that, I spent a lot of time on the liver floors in the hospitals. And, I often will try to get up. As soon as I'm feeling decent enough to get up and start trying to walk around, I will get up and start trying to walk around the floor of the hospital. And, looking at the patients, because often the doors are open, or I'll see other patients, up trying to move around. Basically, everybody on that floor has jaundice, yellowing of the skin and the eyes. It's almost like an orangish color. And I guess it depends on the person, too, and their skin tone. I, myself, looked orange while I was in there. My eyes had become very dark yellow. And like I said, my urine was very, very dark during that period of time. But that's one of the things that they're going to check for is your bilirubin levels. Then how well the liver can produce blood clotting factors is another one, or the INR. Patients with altered INR often develop easy bruising and easy bleeding, which is another thing that I've dealt with as well. And I've spoken with so many people who have dealt with this at the same time. The bruising, you just bump into a wall or something like that, and then you get this huge bruise like on your leg or wherever you hit, and the easy bleeding. Now, I have the opposite problem. I have problems with my blood clotting too much. So I'm on blood thinners. I take Eliquis twice a day, and I take baby aspirin once a day as well. So anytime that I've had any bleeding problems is because I bled too much. And, you burst those varices and, start bleeding out like that. It can become a serious, serious problem. The next thing they check for, too, is the current function of the kidneys, or creatinine. And an electrolyte that is a marker for significant liver disease, or sodium, is another thing that they check for. The MELD score ranges from 6 to 40 and is a measure of how severe a patient's liver disease is. MELD can fluctuate based on your current condition, with variations from a few points as lab values vary to a larger increase if you have an infection or an acute decompensation, worsening of your liver disease. There is also a system of exception points in place to give increased waitlist priority to patients with severity of illness or risk of complications are not captured by the MELD score. And one thing I want to add as well, while I'm on this topic, one thing about MELD score is that just because, let's say that you go and you have your MELD score done, and you have a normal MELD, that does not necessarily mean that, your liver is functioning properly. It could be, or that you don't have liver disease. The last time that I had my MELD calculated, it was a 7, and I have cirrhosis of the liver. It was just that in that moment when they captured my MELD was a 7. Now, I've had a MELD that was 34 at one time. This was back in October of 2022. They calculated my MELD and it was 34. Like I said, I was very, very ill during that period of time, and they didn't think I was going to make it much further after that. But I just wanted to make sure that I share with you guys that, just because you go to the doctor, and let's say you go to the doctor, you have your blood work drawn, and you take your numbers and you plug them into the MELD calculator. And I just want to let you guys know this as well. There are MELD calculators online. I will go over the equation for you guys, the way that you can calculate your own MELD, but there are websites, and you can just type in MELD calculator into Google. And it'll take you, it'll, pull up a whole bunch of websites that you can just go to. You can take your lab results from your last labs, and you can plug those into that MELD calculator, and it'll pull your number for you right there. I will say, just be careful if you're going out and calculating your own MELD. I don't want to see anybody freak themselves out and, see that they've got a MELD of 30 or something and they think it's just the end of the world. Please speak with your doctor. If you do go and decide to calculate it, speak with a doctor. Just don't, make any rash decisions because you put your MELD in and it looks horrible. There's a lot of factors involved there, and you could just be right now and just in a really bad place. Taking care of yourself, eating the proper diet, stopping drinking, not smoking anymore, trying to exercise the best that you can. And another thing too that they didn't bring up is making sure that you're eating, consuming as much protein as you possibly can. Your liver needs protein in order to regenerate. It just has to have it. And I talk about this all the time, but if you're dealing with liver problems, this is one of the things that the nutritionist talked to me about. And my GI doctor, one day was like, man, you are just losing weight like crazy. And my health was just, it was not getting any better. The doctor talked with me, he said, have you spoken with a nutritionist at all yet? And I said, no, I haven't spoken with anybody like that. And he said, look, we need to get you in here to speak with our nutritionist. I went in there another day, had an appointment with a nutritionist, and it helped me tremendously. He spoke with me about, my proper diet, making sure that, I'm not drinking more than 2 liters of fluid every single day, 1,000 milligrams of sodium or less per day, which is very, very important. Especially if you're dealing with ascites, you want to keep your sodium levels down as much as possible. Because if you're bringing in excess sodium, it's going to make you retain more fluid in your body. And the thing is too is that they talked to me about 2 liters of fluid or less a day. The more fluid that you drink, that fluid's got to go somewhere. And a lot of the times, if you're drinking excess fluid, it's going to end up in your belly as ascites. So you want to really limit the amount of fluid that you're bringing in. And he also spoke with me about, eating, a high fiber diet to make sure that I'm going to the bathroom properly. And also that I'm eating, steamed organic vegetables, lean proteins, not too much fat. And another thing that he discussed with me as well was the protein shakes. The thing is that there's a lot of people out there who don't agree with me about the protein shakes. And the thing is that I understand, the whey protein and all that stuff, people think it's not good for you and all that. I'm just going to say from my standpoint, I get it and I understand what you're saying. But the problem is that I just could not eat anything during that period of time. I felt so full and bloated all the time because the amount of fluid that I had on my belly. It was putting so much pressure on all of my organs. I felt full all the time. And there was just this humongous amount of pressure that was pushing up on my lungs. It was pushing on my stomach. It was pushing on my bowels. I felt like I had to go to the bathroom all the time. I felt like I was full all the time. And just eating something as simple as like a little piece of chicken would take me an hour to consume it. And it was so difficult to do. And I told my doctor that, that I'm having a really hard time eating food. And he said, well, have you tried drinking protein shakes? And I told him no. And he said, well, why don't you try drinking those? And you can drink them slowly. And I want you to really focus on drinking a protein shake right before bed at night. Because I explained to him, one of the things I was dealing with really bad during that period of time was my energy levels were so low. I was always tired. I laid in the bed every single day, all day for 3 months. And he said, drink a protein shake before you go to bed every single night. It's going to help to rebuild your liver while you're sleeping, and it's going to improve your energy levels the next day. Well, I said, okay, and I started drinking protein shakes. I went through all kinds of different ones. I tried the Fairlifes, the Muscle Milks, you name it, I've tried them. I've tried the protein powders. I've tried the vegan protein powders, the ones that are made with pea protein. I tried the vegetarian protein powders. I have tried all of it, basically. And the one protein shake that worked for me the best were the Muscle Milks. They were easy. I didn't have to go through this whole process and mixing all this stuff up. And when you're tired, just getting up to go to the bathroom can be just such a chore. It was so much easier for me to have the pre-made protein shakes. They were loaded up in my refrigerator. All I had to do was just hop up, grab one, and then go lay back down in the bed. During that period of time, I really wasn't eating that much food at all. I just drank protein shakes for the most part. I tried to have some fruit and some vegetables during the day as well, or at night. And all of a sudden, my energy level started to increase. I started getting up out of the bed. I started going outside and trying to just get in the sun and do a little bit of exercise. And when I say exercise, my idea of exercise was walking around with one of those little sticks that has like the little handle on it that you pull, and it's got the claw on the end. It's like a 3-foot long stick. I walked around my yard with a 5-gallon bucket and one of those pickup sticks and picked up pine cones for a couple hours every single day. I had put my earbuds in and listened to an audiobook and just walked around in my yard because there was nobody here. And if I fell down or started feeling bad, I didn't want to be too far away from the house so I could get back in relatively easy. But it allowed me to get outside and start doing some exercise. And that only came because I started drinking the protein shakes and my energy started to improve. And as more and more that I got outside, started doing more things, the fluid started to dissipate off of my belly. I started to feel a little bit lighter, and then it allowed me to do more things. Which in turn, slowly but surely, the fluid started to come off. I started to feel better about myself. I started feeling more healthy. And, my health just started to improve. Now, did I have a lot of health problems after that? Of course I did. But it at least allowed me to get up out of the bed and start doing more things. And, not only did it improve my health, but it improved my mental health, because when you're stuck laying in the bed all day, every day, it's depressing. It's so depressing. And you feel like, is this going to be the end of my life? Is this what my life's going to be for the remainder of it? Am I just going to be laying around watching Netflix or YouTube or Hulu all day long or reading books? Is this what my life's turned into? And if that's the case, I used to think to myself, this is not the way I want to live. This is depressing. But I decided that I wasn't going to just lay there and just take it. I was going to at least try everything that I could. And doing those things did help improve my life enough for me to get up and start moving around and doing a little bit more. And with that, my mental health improved dramatically. I was in such a bad state of depression while I laid in that bed. But once I got up and started moving around, it's like it was like I had this cloak over me that whole entire time that I laid in the bed. And as soon as I got up and started moving around and got into the sunlight, it's like somebody lifted that cloak up off of me. And I just felt 1,000,000 times lighter. And I just felt better mentally. And I started to look at life through a different lens. I started to have more optimism about life. I stopped looking at it as I only have but this much time, and I started looking at it as I only have maybe this much time. I'm gonna fill that amount of time up with as much as I possibly can, And I'm not going to think about how much longer that I have. I'm just going to, every day I'm going to wake up and I'm going to do as much as I possibly can. I'm going to fill my days up with as much as I can. I'm going to spend as much time with my children as I can. I'm going to spend as much time with my wife as I possibly can. And, you know, things just started to get better for me. I mean, it was like I started a whole new chapter in my life as soon as I started looking at it differently. Instead of just, like I said, looking at it as they told me I only have till next year to live. I stopped looking at it that way. I started looking at it as I've got today, I've got right now, and I'm going to do as much as I can in this moment, and I'm going to fill my time. And like I said, that just really helped improve my mental health, and I just felt so much better about life in general after I did that. So another thing here about it is that the frequency of blood tests depends on your MELD score, and these are reported to UNOS to adequately reflect your current need for a liver transplant. The higher the MELD score, the more often you are required to get blood tests done, as often as weekly. As a patient's condition changes, it is important to keep the UNOS database up to date with your current MELD score reflecting the urgency of transplant. MELD can be complicated to understand. The easiest way for patients and families to understand it is that it's a math formula. You enter numbers in, and it spits numbers back out. In general, the sicker your liver is, the higher your MELD, and the higher you are on the transplant list. When patients and their families or caregivers are trying to manage medications, understanding their condition, and then we add transplant to the mix, simplifying things is always helpful. Another thing as well is that, you know, when you go to have your blood work done, you don't have to necessarily get it done, you know, at your specific doctor's office or at the specific hospital that you need to have your blood, you know, that you're dealing with. You can go to LabCorp or wherever to have your labs done, unless your doctor specifically tells you otherwise. You know, you can go where, you know, if you live in a very rural area and there's a LabCorp there, but your hospital's 3 miles away, you know, 3 hours away, you don't necessarily have to travel all the way to that hospital to have your labs done. You can go to your local LabCorp, have your blood labs drawn, and they can send that information to your doctor, or they'll have it up on the LabCorp website so that your doctor can extrapolate that information and can plug your numbers into the MELD calculator so that they can determine what your MELD score is. Now, I will say that I have had MELD scores all over the place. In the beginning, when I first got sick, my MELD was very, very high. You know, and this is during that period of time that they told me that I had like a year left to live. But as time has gone on, my MELD score has improved. Now, I'm not eligible for a liver transplant, and I've had this question a lot. I actually did a whole video about it once, you know, discussing why I'm not on the transplant list. I've spoken with the transplant team multiple times. The problem is that I've had so many issues with blood clots. My portal vein has been totally blocked numerous times. Just here recently, back this fall, I ended up getting very ill. I started feeling very weak, very fatigued, started getting very nauseous, started throwing up, and basically, you know, just went and laid down one day because I felt bad. And it just happened, just like that one day. As a matter of fact, I had gone to LabCorp that morning to have my labs done from my doctor at MUSC, and when I was on my way home, I was drinking a protein shake, and next thing you know, I felt super sick. And it just happened, just instantly. I pulled over on the side of the road. I thought I was going to throw up. Then I was like, okay, I'm okay. I made it back home. I took my nausea medication, and I went and laid down. Well, after I laid down, I basically couldn't wake back up. I slept for 2 days straight. I knew something was really wrong during that period of time. I was dealing with a lot of stomach pain. I was very nauseous. I couldn't eat anything. When this happens to me as well, I get in this like dream state where reality doesn't seem real anymore. I almost feel like I'm in a dream. And that's how I felt during that period of time. And like I said, I slept for 2 days straight, which is not like me at all. I'm not a big sleeper. I go to bed at a decent time every night. I'm in the bed by 8:30, 9 o'clock at night, but I'm up by 6, 7 o'clock in the morning every single day. And I don't take naps, but I was sleeping all day during the day, all night during the night, and then the next day I slept all day. My wife came home from work early and was like, "What's going on with you?" And I told her, I said, "Something's really wrong. I need to go to the hospital." Well, I'm so glad that I did. Went down to the hospital, went to the emergency room in Charleston at MUSC, and they did a CAT scan and discovered that my tips was completely occluded. So they kept me in the hospital for a week. They had to do an emergency surgery, and interventional radiology went through my neck, and I've got multiple places, and you can see the holes right there where they've gone in. They're all over my neck. They've gone in my neck so many times at this point now. The last time that I went in, they went through this hole in my wrist. They've gone in through my side, they've gone in through my belly button, they've gone in through so many different places, but that time they went in through my neck again. I was awake for the procedure because they couldn't wait on anesthesia, and they broke through the clot. And then about a month later, I went and had CAT scans again to see what was going on with it, to see if, after they had broken through that clot, if everything was still looking okay. After I went and had those CAT scans done again with contrast, they called me and said, "I'm sorry, but you're going to have another procedure because it's blocked again." So I had to go have surgery again. And then here just recently, I had surgery again, and that's the time that they went through my wrist, and I had to have that splenic embolism done. I'd had a splenic embolism done back in January of 2022 or 2023, and my spleen had started to compensate because they got rid of half of it. Well, my spleen started compensating for the other half and started to enlarge again. So I just had to have another splenic embolism done, which I can tell you is extremely painful. Basically, all they're doing is they're cutting off the blood supply to your spleen, and it dies inside of your body. And they had to fix a pseudoaneurysm in my liver from one of the procedures where they had gone in there. They also placed stents in my liver, the second surgery that I had last year in the fall, because they were trying to increase the pressure in those, in the circulatory system around the liver. And that's what I'm waiting on to go have scans for again. They need to take a look at those stents, make sure that the blood flow is going through there okay. I will say, since we're on this topic, that for any of you guys that are out there that are dealing with health problems because of drinking, you're dealing with liver issues, if you've got ascites going on right now, portal hypertension, any of that kind of stuff, if your MELD score is not ridiculously high and they think that they can prolong your life by doing a TIPS, I would suggest getting one done. And it's totally up to you. It's just my opinion. I think that getting a TIPS procedure is a good idea. It's helped me tremendously. It helped me to get rid of the ascites. And I can tell you guys, having ascites is completely horrible. You do not want to have it. But the TIPS procedure is basically where they go in and they place a stent inside of your portal vein to open it up. It reduces the portal hypertension or high blood pressure in the portal vein that goes to your liver. And that can help reduce the ascites in your body, and I cannot suggest that enough. I had it. It's a rather new procedure. I think they started doing the TIPS about 10 years ago, about a decade ago, maybe 15 years ago. But it's not a very old procedure. It does have its problems. I will just go ahead and say that. But I think the risk versus the reward on having a TIPS, I think that is well worth it. It's worth the money, it's worth the hassle, it's worth the headache of having done, especially if you're dealing with ascites, and it can help reduce that. I just think that it's really worth having done. Another thing that I would like to add to this as well is that, and something that I've dealt with, is that if you have your MELD score done, and your MELD score is, let's say that it's a 7 or an 8 or something like that. And I was trying to touch on this subject just a little bit ago, and I got kind of sidetracked. Like for myself, like I said, the last MELD that I had done was a 7. And that was, I think, in the spring of last year. I'm sure that my doctors have calculated my MELD, but they just haven't told me what it is recently. But like I was saying, if you have a decent MELD score, that does not particularly mean that you don't have cirrhosis or fibrosis or scarring of the liver. The MELD score is just a way for them to get an idea of what your liver health is, but the only real way for them to truly determine what is going on with your liver is either one, they can do a fibrosis scan, which is kind of like doing a sonogram, but they focus directly on your liver. And you know, it's one of the tests that they can do. I would highly suggest asking for a fibrosis scan, just so that they can know for sure 100% what's going on. And another thing they can do as well is a liver biopsy, which I've had done too. The liver biopsy, it's not that bad. You think it's going to be this huge painful procedure, and it's not. They just go in, they take a small sample of your liver, and that way they can look at the cells under a microscope, and they can determine for sure if you have cirrhosis or not. A MELD score is not 100% going to tell them what's going on. Like I said, they have to be able to do either a fibrosis scan or a liver biopsy to know for sure. Now they can do CAT scans, MRIs, and they can take a look at your liver, and for the most part they can get a rather good idea of what's going on. But if they want to make 100% sure what is going on, if you have cirrhosis or fibrosis, they're going to need to do a fibrosis scan, and they're going to need to do a biopsy in order to determine exactly what's going on with you. But if they take your MELD and they put the calculations in, and you have a MELD that comes, shoots out of that equation and it's 30, I mean, chances are that you probably do have either cirrhosis or fibrosis or hepatitis or something like that. But like I said, they need to do either a fibrosis scan or a biopsy to 100% determine what's going on with your liver. So really quick, before I get off here today, I've talked about MELD, what the acronym stands for. I've talked about how they calculate it, talked about all that stuff. And before I get off here today, I just want to talk about cirrhosis of the liver. I just want to go over some quick stuff about this, talk about some signs and symptoms of cirrhosis, and just give you guys an idea of what to be on the lookout for, whether it be yourself, a loved one, a friend, family member, whatever it may be, so that you can have the knowledge and the tools to know when it's time to go speak with a doctor. So signs and symptoms of cirrhosis depend on how advanced it is. You might not have symptoms at all early on, or might only have vague symptoms that resemble many other conditions. Symptoms of cirrhosis become more recognizable as your liver function declines. For example, you might see signs that bile isn't traveling where it needs to go, instead is overflowing into places it doesn't belong. Before I had my cirrhosis diagnosis, I had pain in my liver for so long. Every single day, I would have a dull pain in my liver, and sometimes a very sharp pain. But I could feel my liver every single day. It was like this weight on my right-hand side, right underneath my rib cage. I could just feel that my liver was there. And if I laid down in the bed and pressed down, it was very hard. I could press down on the left-hand side of my stomach, and I could actually get down underneath of my rib cage if I wanted to. I could not do the same thing on the right-hand side. But let's talk about what are the first signs and symptoms of cirrhosis of the liver. Early signs and symptoms of cirrhosis may include nausea or loss of appetite. I dealt with that. Feeling weak or tired, fatigue, I dealt with that as well. Feeling generally ill, malaise, I dealt with that as well. Upper abdominal pain, especially on the right. Visible blood vessels that look like spider angiomas. And I've spoken about this, but I've got them all right here on my face and on my nose. Redness on the palms of your hands. That's something I've never dealt with. What are symptoms of advancing cirrhosis? Recognizable symptoms of cirrhosis fall into two categories: symptoms related to declining liver function and symptoms related to portal hypertension. Symptoms of stalled bile flow, like jaundice, are common indicators of declining liver function. Symptoms of portal hypertension indicate cirrhosis specifically, which is something that I have been dealing with now for years. It's scar tissue in your liver that compresses your portal vein. Cirrhosis symptoms related to declining liver function include jaundice, yellow tint to your skin and eyes, pruritus, itchy skin with no visible rash, dark-colored pee, and light-colored poop. Digestive difficulties, especially with fats. I dealt with digestive issues for years and years. Small yellow bumps of fat deposits in your skin or eyelids, and those are like these little yellow bumps that you get around your eyes. I've not dealt with that. Unexplained weight loss and muscle loss. I dealt with that extremely bad. I lost all my muscle mass and lost a bunch of weight. I weighed 250 pounds before I got sick. After getting sick, I dropped all the way down to about 115, 120 pounds. Hepatic encephalopathy, confusion, disorientation, and mood changes. Motor dysfunction, twitching, tremors, or lapses in muscle control. Disruptions in your menstrual cycle. Enlarged male breast tissue and shrunken testes. Cirrhosis symptoms related to portal hypertension include swelling in your abdomen, ascites. I had that really bad. And I've talked about this, but I think that is absolutely the worst part of cirrhosis is the ascites. It's painful. It's very uncomfortable. You feel very uncomfortable just being out in public because you're embarrassed about the amount of fluid that you have in your stomach. The traditional beer belly thing, somebody that's really skinny with a big old belly. That's what it looks like. Easy bleeding and bruising. Blood in your vomit or blood in your poop. Low urine output from chronic kidney failure. Shortness of breath from chronic respiratory failure. That is one thing when I was extremely ill. I could not walk up a flight of stairs, like 4 steps, without being out of breath. What are the causes of cirrhosis of the liver? So what are causes of cirrhosis of the liver? Cirrhosis is a gradual scarring process that's triggered by chronic inflammation in your liver. Any chronic liver disease that causes chronic hepatitis can lead to cirrhosis. The most common causes include alcohol-induced hepatitis. This is a chronic liver damage from chronic heavy alcohol use. Alcohol may be the most well-known cause of liver cirrhosis, but non-alcoholic causes are also common, or NFLAD, non-alcoholic fatty liver disease. Non-alcohol-related steatohepatitis. This is a chronic damage from excess fat storage in your liver. It's related to metabolic factors like high blood lipids, blood sugar, and blood pressure. Chronic hepatitis C infection. Hepatitis C is a viral infection that becomes chronic in most people. It is now curable with antivirals, but many people don't realize they have it. Chronic B hepatitis infection. Hepatitis B is a viral infection that may become chronic in a minority of people. If it does, you'll have it for life. It's treatable, but not curable. Less common causes of cirrhosis include autoimmune biliary disease. Certain autoimmune diseases can cause chronic liver inflammation, including autoimmune hepatitis, primary biliary cholangitis, and primary sclerosing cholangitis. Genetic disorders. Certain inherited conditions can cause toxic substances to build up in your liver and damage it, such as glycogen storage disease, cystic fibrosis, and Wilson's disease. Toxic hepatitis. Long-term exposure to certain environmental toxins or use of certain medications may cause chronic liver damage, including over-the-counter painkillers, such as Tylenol. Cardiovascular disease, conditions that cause blood to build up in your liver, congestive heart failure, or that prevent blood from reaching your liver can damage it. What are some risk factors for this condition? You might be at a higher risk of cirrhosis of the liver if you are older than 50, have a history of heavy alcohol abuse, have a chronic viral hepatitis infection, have metabolic syndrome. What are the complications of cirrhosis? Downstream effects of cirrhosis and portal hypertension include general toxicity, feeling ill, tired, and foggy, reduced immunity, healing, and recovery, fluid leakage from your veins causing swelling in your body, hormonal imbalances and deficiencies, digestive difficulties, malabsorption and malnutrition, mild cognitive impairment and motor dysfunction. Life-threatening complications of cirrhosis and portal hypertension may include gastrointestinal varices and gastrointestinal bleeding, spontaneous bacterial peritonitis, kidney failure, respiratory failure, chronic liver failure, and liver cancer. So how is cirrhosis of the liver diagnosed? Blood test, a panel of liver function tests can show signs of liver disease and liver failure. This means liver products like liver enzymes, proteins, bilirubin levels in your blood. Blood tests may indicate specific diseases or known side effects like reducing blood clotting. Imaging tests like an abdominal ultrasound, CT scan, or MRI can show size, shape, and texture of your liver. A special type of imaging test called an elastography uses ultrasound or MRI technology to measure the level of stiffness or fibrosis in your liver. That's what I was talking about earlier. Or a liver biopsy. A liver biopsy is a minor procedure to take a small tissue sample from your liver to test in a lab. A healthcare provider can usually take the sample through a hollow needle. While not always necessary, a liver biopsy can confirm cirrhosis and may help determine the cause. So guys, that's basically MELD in a nutshell. And I just wanted to go over cirrhosis again really quick, just so that you guys are aware of the symptoms of it in case, yourself or a loved one, you might be concerned that they might have it. The thing is that it's a very simple blood test to get your MELD calculated. Very simple. And the thing is that if you, in fact, go to your doctor, tell them that you're worried about it, they go ahead and put the order in. You can go to any one of your local laboratories, have your blood work drawn, and then they can take that blood work and post it. That way your doctor can pull that information. They can plug it right into their MELD calculator. I'm sorry about that beep, guys. I haven't heard it all day, and all of a sudden it's going to start. But like I said, they can take those numbers, they can plug them, and then they can figure out what your MELD is. If you go to your doctor and they plug your numbers and your MELD comes back as a 20, it's probably time to go have further investigation done, further steps, further tests done to determine whether or not you have either fibrosis, cirrhosis, hepatitis, whatever it may be. But the thing about this is, guys, is that early detection is the key to living longer. If you go with blinders on your eyes, you're always doing this and walking around and saying, I would rather not know, which is what I did. I always told myself I'd rather not know. I can promise you that hindsight is 20/20. And if I could go back and reverse the hands of time and go get tested years ago, I would have done it if I knew what I knew now. And that's why I come on here every single day and talk with you guys to share this information, because I want to give you guys the education to be aware, to know that early detection is the best cure. If you go and find out that you have fatty liver disease, non-alcoholic fatty liver disease, because this doesn't necessarily just apply to people that drink. You could be somebody who was a teetotaler and never drank a drop of alcohol in your entire life, but you drank soda all the time. Your diet was horrible. You ate seed oils every single day. You ate candy and sugar and all this kind of stuff. That can cause non-alcoholic fatty liver disease just by poor diet, or just by being overweight, not exercising. products from your environment, toxins that are, might be absorbing through your skin, or medications that you might be taking could cause problems with the liver. There are many reasons why we can end up with liver disease. But like I said, early detection is the key. And also educating yourself and being aware of these things so that you can go ahead and take care of it in a quick manner, and you might be able to stop it from progressing from fatty liver disease to cirrhosis. Because by stopping drinking now, getting your diet back in line, exercising, drinking plenty of water, stopping the sugar, stopping the seed oil, stopping the alcohol, stopping the medication or the drugs or whatever it may be, you could potentially reverse that fatty liver disease and get your liver health back. Our liver is the only organ that can regenerate itself. It is such a miraculous organ that we have. And with early detection and going ahead and speaking with your doctor, I know how scary it is. Trust me, I do. But if you go ahead and take care of it now, you could potentially save your life. And think about your loved one. Think about your kids. Think about your family. Think about your friends. All the people that are going to miss you so much. And all that you have to do is just go get it taken care of. Go get tested. Go have your blood work drawn. If your MELD comes back and it looks pretty good, they might not have to do anything further at that point. But at least you know. And like I said, with knowledge, it's the key. It is what could potentially save your life. And I know right now you're probably thinking, oh, well, I'm probably okay, or I'd rather not know, or you might already know. But don't be like me and say, I'd rather not know. That I'd rather just wait. Because if there is one thing I can promise you, when you're laying in the hospital bed and your belly is distended by 1.5 feet and your skin and bones, and you can't even barely even get up out of your own bed, and somebody's got to help you just get to the bathroom, or you're peeing in one of those little urinal things, and you're in the hospital on the liver ward wishing that you weren't there, I can promise you that you're going to look back and wish that you had gone and gotten this taken care of early, because it can be reversed. So guys, like I said, it's a quick blood test. Go speak with your doctor. They can do that, and if you feel like it, you can take those numbers, you can plug them right into the MELD calculator yourself, and then determine where you want to go from there. But with knowledge, we can achieve so much more. We really can. And if there's one thing that I can promise you guys, is that you do not want to end up with liver cirrhosis. You just don't. There's so much more to this life to experience. There's so many more things that you haven't been able to do yet. You want to go do those things. Go get tested. Get yourself checked. It's pretty simple. And at least you'll have the peace of mind, and you'll know. Just think about it. You go get your MELD checked. It comes back okay. That's going to be peace of mind. You can go ahead and move forward. Stop drinking. Stop using whatever that substance is. And you're going to have that peace of mind knowing that your liver's doing okay, and that you got sober, and that you can go on living the rest of your life and not have to worry about this. It's not worth the amount of time, effort, stress on your family, stress on yourself, the money that you're going to spend, and the amount of worry that you're going to have. It's just not worth it. So guys, with that said, I think that's basically all I have to talk about with the MELD score today. I really do appreciate you guys watching. If you haven't subscribed to the channel yet, please subscribe. If you're new here, please think about subscribing to the channel. I make videos every single day. I talk about all kinds of different topics. A lot of the discussions that I have on here are just things that I've experienced, things that I've been through. And once again, I really do appreciate you guys being here today. Before I get off of here, I just want to quickly talk about Buy Me a Coffee. I did start a Buy Me a Coffee last week. I will put the link right up here on the bottom of the screen. If you feel so inclined to help support this channel, it helps me to keep doing these videos every single day. I can dedicate all of my time and effort. It's like today, I tried filming this video since like 11 o'clock this morning. It's 3 o'clock. I've stopped, had to start back over, all kinds of stuff. It takes a lot of time to do these videos, reply to all the comments. I speak to people every single day. You know, it just allows me to invest all of my time into helping people. I work 7 days a week on this channel. I never stop. I'm laying in the bed at night before I go to sleep, replying to comments, you know, all kinds of stuff. And like I said, I would just really appreciate it if you consider donating to buy me a coffee. It really does help me out and my family out. And like I said, it allows me to continue to do these videos and dedicate all of my time into it. And that's what I want to do. I want to try to help as many people as I possibly can. So I'll throw the link up here. I'm also going to throw up everybody's name who has donated to a Cash App, Super Thanks, and the Buy Me a Coffee in the past day and a half. So thank you so much to all of you guys who have donated to the channel. I can't tell you how much I really do appreciate you going on there and donating and taking your hard-earned money and sending it my way. I truly do appreciate it. And thank you so much for doing so. And with that said, guys, I hope that each and every single one of you has a wonderful rest of your day. And until tomorrow, I will see y'all then. I love you guys so much. Bye-bye.